and welcome to a new episode on The Doctor is In. My name is Nayla Mezher and I'm a clinical dietitian at Cleveland Clinic, Abu Dhabi. I am happy to be joined by two special guests today, Dr. Allison Herbert and Dr. Mahmoud Al-Hawamdeh. Dr. Allison, could you please tell us a little bit about yourself?
Yes, good afternoon. I'm Dr. Allison Herbert. I'm the chair of Preventive Medicine here at Cleveland Clinic, Abu Dhabi. I've also been the lead physician of executive health for the last 7 years. Dr. Mahmoud.
Yes, good afternoon. My name is Dr. Mahmoud Al-Hawamdeh. I am a consultant internal medicine physician, and I've been at Cleveland Clinic, Abu Dhabi for 11 years. I was excited to join the executive health team recently, and before that, I was the chair of hospital medicine department.
Thank you. So in today's episode, we're going to explore the executive health program, why we have it here in Cleveland Clinic, Abu Dhabi, what it offers, how it supports long-term wellness and disease prevention, and how to enroll. Dr. Mahmoud, I'll start with asking you the first question. Could you please tell us why do we have this program here in Cleveland Clinic, Abu Dhabi?
Thank you for the question. As the name implies, the executive health visit, originally it was designed for executives because of their busy schedule and the navigation of the healthcare system is not easy. So we want to make sure that these executive patients and busy professionals are able to get their complete and comprehensive medical evaluation, checkup, and all required tests in one setting. And it's not a new thing. It's been in the market for more than 50 years. And at Cleveland Clinic Abu Dhabi, we have started this program at the time of inception of the hospital. And we're very proud to say that it's a growing program. And it's not only open for the executive, it's open for any patient who are concerned about their health and they want to take charge of their health and be in the driver's seat and get to know about their medical problems, get all the needed follow-ups and checkups, and focus on lifestyle and ways to prevent their diseases in the future.
Thank you.
Yeah, one thing I was just going to add, Dr. Mahmoud, is that when people hear executive health physical, it's basically a comprehensive physical, and in the traditional sense, people go to their primary care physician, their internal medicine doctor, and it takes about 15 to 20 minutes to do your general checkup. And during that time, which is a brief amount of time, a physician is encouraged to try to get through as much past medical history and go through all the health maintenance items, discuss cancer preventions, and they'll order an array of a much smaller set of blood tests. And then the patient is then expected to go do, 1 through 10 or however many things that the physician refers them for over the course of what could take up to several months. What the executive health program does is that it allows for that physical to happen. However, it is a one-stop shop. It's all in a singular day, and the patient is able to leave at the end of the day with a comprehensive overview of their current state of health. So there's no confusion, there's no waiting for test results, there's no waiting to be scheduled, and it's really, really quite convenient. And it also just allows for a more intimate relationship with the physician. So just wanted to add that to what you said.
Yeah, that's great. Thank you so much for this addition. Can you walk us through a typical day for an executive health when the patient comes in, what they expect and what they do and what they go through?
Sure, I'd be happy to. So when someone's interested in executive health, and we'll share this at the end, they usually reach out to our scheduler and get scheduled. And what happens first is that we have about a 6-page medical questionnaire that we want the patient to fill out so that we can get to know them as much as possible. Then the patient will be scheduled with a nurse to have about a 30-minute phone call to go over that questionnaire, because we want to make sure that we get all of that information plugged into our electronic medical record and to be as thorough as possible before they even enter our doors. The nurse also identifies any problems that the patient might be having at the time so that we can tailor the visit when they come in and add on any type of visits that they might need or any type of testing that they might need. So that phone call and that questionnaire is very important. So then when the day the patient comes in for when the day that they're scheduled, they actually come into our front desk. They're greeted by one of our executive health ambassadors. This is what basically like a personal assistant that they're going to have for the entire day. They get shown to their suite. We have 12 suites in our department, which are really quite lovely. They have a little living area. They have their own exam room. They have a full bathroom and shower. So they get tucked in the morning. It's almost like checking into a hotel room. One of our culinary team members comes in the morning. We have a menu where they order breakfast, they order lunch, they order the variety of drinks and snacks that they want for the day. And then the nurse comes in and spends about anywhere from 30 minutes to an hour doing their initial assessment. They go over medications, they do an ECG, they do an in-body, they just review the day with the patient. After the nursing assessment, the nursing hands off to the physician, and then the physician goes in with the patient. And depending on how complex the patient is, that initial consultation will take anywhere from 30 minutes to an hour. And this is a time where the physician goes through the medical questionnaire again in detail with the patient and also addresses any worries or concerns that the patient has for the rest of the day. It's not uncommon that there's a new concern that pops up, and the physician can add on something if needed throughout that morning for the patient for that day. Then the patient's off and running, and then it's a variety of tests that we do, and each program is slightly different. We have a standard package for people that are under 50 typically. We have a premium package which includes some more testing that is traditionally more appropriate for people over the 50 years of age. However, what package that you need will be identified during that initial nurse call. And at the end of the day, there'll be a time once all the test results are back, and we have most things same day that are back. But at the end of the day, the physician will meet back with the patient, and you're going to be explaining a little bit. You're going to be explaining a little bit more of that coming up. But 2 points that I want to raise that I think are really special about our program is that each patient gets to spend about 30 minutes actually an hour with our sports therapist to assess mobility, to assess flexibility, to identify any problems, with their exercise routine, and to get some tips and tricks on what they need. If they need any future physical therapy appointments, that individual can refer the patient on. And also they get 30 minutes, sometimes a little bit longer, with one of our nutritionist team members. And Nayla, I would love for you to kind of explain, just being one of our nutritionists, what you do with the patients.
So nutrition is a very important part of the executive health program because as dietitians, we help patients develop healthy eating patterns. So we sit down with the patient, we review their lifestyle, lab results, and personal health goals. And as part of a multidisciplinary team, alongside physicians like yourselves, nurses, and physical therapists, we create a personalized plan that is practical and easy for the patient to add to their daily routine. We also support patients with coaching on everyday challenges like healthy eating on the go, managing stress through food and healthy eating, and improving their sleep also with proper nutrition. Some patients require follow-ups, so we also offer that for continuity of care and to monitor their progress and to adjust their plans as their needs evolve. So as you see, nutrition is not just about dieting, it's more about fueling patients with energy, mental clarity, focus, and long-term health.
Yeah, that's a great, Nayla. Thank you so much. I like the idea of the multidisciplinary approach, and this is one of the highlights of our program is throughout the day, the patient will have a multidisciplinary approach by different physicians and providers, and there is a continuous interaction between the main physician and these disciplines if there is anything abnormal throughout the day, and they discuss the plan, if there is any need to change or tailor the the approach different based on the findings, and that's one of the amazing things before the end of the day when you have the wrap-up session. And the wrap-up session, I would say it is probably the most important time that the physician spend with the patient is about 30 to 60 minutes of valuable time where the patient has done and completed the visit and then sit face-to-face with the physician, and then they have this verbal communication about all the visits, all the findings, and we put together a customized and tailored plan of health in regard to a new problem found and treatment or follow-ups needed, or a reassurance on certain things that we checked and they were normal. And also we summarize all the findings of the different physicians, different disciplines, and different tests that were done. In addition to the verbal communication and this valuable time, about 1 hour spent with the patient, there will be also a completed, clear written report sent to the patient within a couple of days from completion of this visit, and they can use this as a document that they can share with their physicians when they go back to their community or to their country if they are from outside the country. And this to make the patient feel like they really spend a valuable time with the healthcare at Cleveland Clinic Abu Dhabi, and they come up with a customized, tailored approach, not to treat a problem, but also to prevent any problem, with focus on lifestyle, health, and nutrition, as you mentioned, and exercise programs and everything else needed for them.
Yeah. I do have a question, Dr. Mahmoud, and maybe you can help answer this, is that, if you do find a problem with a patient, what do you do with what do you expect the patient to do with that?
Yeah, ideally, this patient is our patient, and we are there to serve the patient and their needs and provide them with the resources needed. So ideally, we want them to follow up with us, and we will refer them to whatever needed specialist. We're very lucky at Cleveland Clinic Abu Dhabi that we have all the subspecialties and all the subspecialized care that any patient will need anywhere. So if the patient chose to follow up with us, ideally this is the right thing to do, and we'll take care of it in a timely manner. If the patient chose to go back to their countries, if they are from outside country or they want to follow up somewhere else, we provide them with the advices and with the medical report and written comprehensive report. And if there is any verbal communication, even with other physicians, we'll be happy to provide that.
Yeah, that's good.
So, Dr. Allison, as you're the lead physician for the executive program and you're leading this for many years, I heard about exciting new additions and changes in our executive program. Can you give us some information about these changes?
Yes, we're really excited about this. We've been working many months on it, and it's really in response to the patients that have been coming through the program. We have gotten lots of questions about dementia, right, and how can we protect our brains. We've gotten lots of questions on cancer and how can we diagnose early, how can we prevent that. We've gotten questions on what are the latest genetic testings, and what can we offer? The proteomics testing, gut microbiome, all of these things. We have listened to our patients and we've heard what they've been asking, and now we're really excited to be incorporating some of those advanced diagnostics into our add-ons, should patient want to choose them into a package. So that will be coming out in September. We're very excited about that. The other thing that we're going to be doing is creating a new package. So we have the current standard package that I mentioned earlier and the premium package. That's the under 50 and over 50, so to speak. We're now going to be launching a platinum package. And our platinum package is going to be including a whole body MRI because lots of patients come in and ask us about that. They want that. And then we're also going to be substituting the traditional exercise ECG stress testing with what's called a VO2 max test. That's also going to be able to, that's a cardiodiagnostic test to make sure that the patient's heart is okay. But it also includes metabolic testing, which a lot of people are very interested in, just to have a baseline. And then also, once they leave us and go work on their lifestyle changes, when they return in a year, want to repeat the test to see if there's been any improvement. So those are the two main differentiators in our platinum package is the whole body MRI and the VO2 max testings. There are some other minor differences, but we hope that some of the patients will reach out to us in September and find out what those are. The other thing that we're going to be doing to enhance all of our packages in the very near future is to add a brain health segment. So much like what you do, Nayla, with our nutrition segment of the day, and like our sports therapist does during the sports therapy session, we're going to be offering a brain health segment. And we are working with our neurology department and our psychiatry department to design this program. And the idea is, how can we keep our brain as healthy as possible? A lot of it comes down to sleep, to eating healthy, to exercising, minimizing alcohol, not smoking, all lifestyle things. But people have so many questions on how to prevent dementia, what they can do to, for a better work-life balance. So we're really excited about introducing this into all of our packages. The other thing that we're going to do is a more dedicated women's health and men's health program. For all ages. So currently, men only usually see the urologist if they're of a certain age that need prostate cancer screening. But what we've learned in the years that we've been at Cleveland Clinic Abu Dhabi is, again, we've listened to our patients, is that no matter the age, a male might have problems that they might need to speak with the urologist about. And similar for women. There are lots of hormonal questions that women have, and they want answers. So this is going to provide those patients an opportunity to actually sit down, have dedicated program and dedicated time with those physicians. So we're really excited about what's coming, and that's going to hopefully start kind of gradually over the summer, with hopefully being full on in September. So we're hoping that we're going to see a lot of increased business just from adding those things. But most importantly, for the patients that are already seeing us, we just want to have a comprehensive, overview of their current state of health, to be able to relay any fears, answer any questions that they have, so that they can leave at the end of the day from our program with understanding their current state of health, and most importantly, having a clear roadmap about what to do to treat any diagnoses that they have, and also to prevent any future problems. So we're really excited about that.
Yeah, that's exciting. Dr. Mahmoud, could you tell us, how can patients sign up to the program?
Yeah, thank you so much. Signing up is very easy. You can check the website for the hospital, and under Executive Health, there is a link that will take you to registration. There is a phone number, and there is a WhatsApp number. If you don't have these numbers, you can just contact the main contact center in the hospital, and they will lead you to the appropriate department. And we have designated, dedicated team for Executive Health that will make it an easy journey and very easy to sign up.
Okay, so this brings our episode to an end. I want to thank you, Dr. Allison and Dr. Mahmoud, for joining us today. This conversation was very informative. And for our listeners, thank you for tuning in. We hope you found this helpful. And a reminder that your health should always come first. We encourage you to come visit our Executive Health program at Cleveland Clinic Abu Dhabi, because taking care of your health is the best investment that you can make. Take care, and hope to see you soon in another episode of The Doctor Is In.